Hi, friends and fellows. Welcome to the second episode of Wellscape, where we explore the global landscape of healthcare, wellness, and health protection. It's 9 a.m. in the morning in Bali, Indonesia, and here with me is Dr. Gusti Nyoman Trianantha from BaliDoc. Good morning, doctor. How are you?
Good friends, fine. How are you as well?
I'm good.
Okay.
So, doctor, before we start the conversation, can I ask you a favor to an introduction for our audience?
Yes, of course. So, hello, friends and audience, and also hello, Mr. Rio. And I'm Dr. Gusti Nyoman Trianantha, so that's my full name. I know it's a very long name. So maybe to make it quick and make it short, you can call me Dr. Tri. So I'm from BaliDoc. It's like the online-based teleconsultation. We can call it nowadays is a telemedicine. So it's like long range. The online medical service. So maybe that's a quick introduction from me. Mr. Rio, thank you.
Okay. Thank you so much for sharing with us, Dr. Tri. So I believe you have experience for several years as a doctor. And among all of the good things that you have experienced as a doctor, can you tell us one that is like the most meaningful to you?
The favorite things I love when handling the patient is talking with the patient. Some like a depth consultation. So I know what is the patient problem, what is their underlying disease, what is their background, and how they are doing their activity. And meanwhile, I'm asking that kind of question. I just like having a big picture, what is their lifestyle, because nowadays there is many non-infection disease like diabetes, obesity, stroke and heart disease also, but not all the doctor can find those underlying reason, and not all the doctor asking the lifestyle of the patient. They just asking are you smoking, how many times are you smoking per day, and do you consume the alcohol or not. But many of my fellow forgetting to asking what's your sleep routine, and how is your rest, and how many hours do you have time to rest. That's the different story. If the doctor asking the patient some specific part, the patient may they doesn't want to fully open, but when we are asking more depth question, they slowly want to open themselves to the doctor.
Yeah.
But the challenging part of handling the patient in Bali, especially the international one, maybe many doctors in Bali experience this thing, and maybe Mr. Rio also. That's the language barrier. That's not because English is not our first language. Somehow we're talking with body language too, right? but in some purpose, the patient and the speaker get to know what they need, and that's what it makes more challenging.
Okay, interesting. You mentioned about the language barrier, and in Bali right now, we have a lot of foreign tourists from all over the world, right? And there are many nationalities coming, like the tourists from countries like China, for example, Russia, and also some from the South American part, maybe, for example. How do you handle people from the different background, and possibly also the different understanding of medical treatment as well, depending on the standards from their own country?
If we are talking about the standard, especially we are in Indonesia, that's a big, let's all of us know that Indonesia standard is based on Asia standard.
Yeah.
So Asia standard is a very different to Europe standard, especially in the availability of the medicine. So when the patient come to Indonesia, he must follow the Asia standard or Asia guideline first. So because we need to find the availability of the medicine. In BaliDoc, we encounter many difficulty like this. So the patient from Europe, they're traveling or living for a short time in Bali, like maybe 1 or 2 months. but they bringing their own medicine, and somehow, like let's say they are forgetting their medicine at home, or they lost the medicine on the way here. They need the same name, the same doses as they receive back in the Europe. So somehow, if we offering the replacement medicine, they need to confirm with their doctor,
Okay, I see.
allow or not. And the doctor is allowing with the temporary replacement medicine. Usually, they will come back to us asking for the same medicine that we are offering.
So far, Doctor, we can say that Bali's tourism activity is still centralized in the southern part, right?
Yeah.
And actually, there are a lot of areas in Bali that is considered as a rural areas, right? And maybe at that part of Bali, the healthcare sector is not that good enough for now. So how do you think BaliDoc can be the good help for the people who live in that rural areas?
We are BaliDoc is the online-based consultation. We can call it the telemedicine, right?
Yeah.
So, in terms of definition, the telemedicine is the health service that utilize information and communication technology to provide a long-distance health service and reach area that difficult to access. So that's the main point and purposes of the BaliDoc. So the challenges remain is about the accessibility to good quality of internet to provide the telemedicine health service. So let's say the patient in the rural area, everyone right now must have mobile phone, right?
Internet connection, and the mobile.
Even if you go to rural area, you always have your phone with you.
Yeah.
The last one challenging is the internet quality. In Indonesia, it's internet quality is not okay. Or maybe in the place A is very very low, but it is not a big wall to us. As long as the patient try, we will reach out the patient. So they can do the teleconsultation like this. We can offering our package, so we can talk about discussion about the medicine that they needs, and we can also provide where the nearest pharmacy from the patient location. Usually we can use the Google Maps. And also the BaliDoc have partnership pharmacy. So let's just say the patient doesn't want to leave the hotel, and they need the medicine, let's call it medicine A. We can provide the delivery medicine, so they don't have to leave the room.
Hi everyone, let's take a quick 1-minute break before we continue the discussion. At Look Medical International, we see healthcare, wellness, and health protection as a unified ecosystem. If you're an expat living overseas, finding a trusted medical facility with international standards can be challenging. And that is where we come in, to help you access the best medical care available. But great healthcare is even better when you have comprehensive international health protection with worldwide coverage, so you can enjoy peace of mind knowing that not only is your medical care secure, but your finances are protected as well. We partner with the world's leading international insurers, offering a wide range of plans, all in one place. Our job is to simplify the process, compare options for you, and help you find the best coverage that fits your budget and medical needs. No more confusion, no more endless searching. Just expert guidance to make your decision easier. Scan the QR code now to get a free insurance consultation and discover how we can help you to stay protected wherever you go. Now, let's get back to the video. Thank you so much for sharing. So, let's get back to the discussion about the online platform for doctors' consultation. Okay, so how do you think the digital sector can disrupt the healthcare in Indonesia, and how far it can help people in the future?
So, teleconsultation is like one of 6 pillars of our governor, like Kemenkes. They make a news that they have a new 6 pillar. One is innovation and using of medical technology. So one of it is telemedicine. So to provide non-accessibility area, like we can say the patient living in the mountain, but they have a good quality of internet. But because of some condition, they cannot go to any places besides of their small space of house. So they can use the teleconsultation, they can use the telemedicine to get like a healthcare service, to assess what the patient needs and also to get the medicine from the telemedicine. I think one of our hospital in Bali have already done that. I think it's called the Bali Mandara. They have already done the telemedicine and they already reached out the patient. I think in the Mount Batur, they have the patient at the Mount Batur and they provide that kind of service. But in BaliDoc, we use that as our example and we will move forward with that. So I think the telemedicine in the further years, it will be very, very helpful to the patient, and it will be very, the technology improvement in healthcare is like a new thing to us. So one telemedicine will be very, very amazing, I think, in the next year.
Yeah, let's talk about the goal from BaliDoc, Doctor. So what is the goal from BaliDoc in the next few years?
So BaliDoc is currently focused on facilitating the healthcare service, particularly teleconsultation or online-based consultation. However, we also ensure that the patient using our service receive comprehensive support and experience convenience additional service such as medication delivery, for which we have established strategic partnership in Bali. Moreover, we can also provide home visit, lab tests, and also specialist consultation. We just it's like 1 or 2 months we just find our partner in specialist consultation. It's especially the psychiatrist, and right now we are like to expanding our field, so we are looking for other specialists to make sure our service is very comprehensive and meet with the patient needs. So we will continuously working to enhance our service. In the coming years, our goal is to establish BaliDoc as a one-stop healthcare solution, especially for tourism and expat in Bali.
Doctor, with what we have for now, we can say that Bali's medical sector is already having an international standard, right? And we know also that we are now having this hospital called Bali International Hospital that is going to open very soon. So, I mean, the direction of Bali's medical sector is going to the very positive direction, we can say. But there is always a room for improvement, right? So, if there is any room for improvement for now, what do you think the things or the specific sector that we can improve?
So, yes, the Bali International Hospital will be open soon in April, I guess. Yeah. So
right.
before the Bali International Hospital, we have the small one. We call the BIMC.
Yeah.
The Bali Medical Center. That's the one. But we know we have many layer of healthcare facilities. Like the first line layer, the second line layer, the national standard, the international standard, the Asia standard. We use many standard as our level. But that's why I want to say is, yes, I'm agree with you, Mr. Rio. There is always a room for improvement, but we need to align our international medical standard first. So there is no misperception, there is no misunderstanding in the medical standard, and we need the international accreditation hospital to make sure our international medical standard is in the right way. BaliDoc will provide the teleconsultation and telemedicine to much wider area, and with our capability and easy access to internet to freely learn anything there. Let's strengthen emergency medical service, meet the international medical standard, better in insurance acceptance, improve healthcare accessibility for both local and foreigner, and improve in closing the gap in different language. So we need to learn a new thing every day. As you said before, there is always room for improvement. There is always room for improvement. We need to improve ourselves first. So before we enchant our community or our surrounding, we need to enchant ourselves first. The patient who is having the chronic illness, we need to do the very much examination, right?
Yeah.
So we are hopefully having like MOU, or we are having like the conjoin with the international hospital.
Okay, thank you so much, Doctor. My last question will be, what is your wish for Bali's medical sector for this year?
We already talking much before, yeah. But my wish is, we know there's many private general practitioner practice and clinic as a first line healthcare, and many hospital as a second line healthcare in Bali. With our capability and easy access to internet to freely learn anything there, let's strengthen emergency medical service, meet the international medical standard, better in insurance acceptance, improve healthcare accessibility for both local and foreigner, and improve in closing the gap in different language. So we need to learn a new thing every day. As you said before, there is always room for improvement. There is always room for improvement. We need to improve ourselves first. So before we enchant our community or our surrounding, we need to enchant ourselves first. That's the way to strengthen our surrounding as we wish for the healthcare sector.
Thank you so much, Doctor. Of course, we wish nothing but the best for the Bali's medical sector.
Yes.
Thank you so much for your time, Doctor. This is the end of the show.
you.
We really appreciate your time. So thank you so much for those of you who are watching the show. And always remember, if you are looking for teleconsultation services while you are in Bali, please keep BaliDoc in mind because they are providing a great services, especially in the place where it's considered as the rural areas. If you want to know more about BaliDoc or you want to make an appointment, you can click the link that we put in our description box below. Yeah. So thank you so much for watching. See you next time.